And there's like sometimes like that we get programmed like claustrophobia. Yeah, let's say you're at the age of 2 and you lock the door of the closet and you got stuck in there. Yeah, and you didn't know what to do. You're crying, screaming, and so on. But now you're 30 and you have claustrophobia and you don't know why. But that is the reason why, because that happened to you. Mm-hmm. Yeah? And when you're able to remove that, then you're able to heal your claustrophobia, or you're able to heal your stress or depression. Yeah, because there's always an underlying reason for that, and it's in the energetic level.
All right, we're back. Hey, Kristof, how's it going?
Good. How are you doing?
I am doing good. We've got a lot to kind of get into here, so I'm really excited to talk to you about a whole bunch of different things. But first, before we kind of get going and finding some rabbit holes and stuff like that in regards to energy medicine and energy healing in Costa Rica and the medicine community and everything else that you've kind of found yourself immersed in. This isn't really your background, right? You're not from Costa Rica. You haven't always been a Neo Shamanic energy healer. There's something about engineering in your background. You've been an executive. How did you find yourself in Costa Rica, and where were you before you were down there?
Yeah, good question. Well, if you would have asked me that question a couple of years ago, I would have never thought that I would be here and doing the Neo Shamanic energy healing work. Yeah, I'm originally from Belgium. Yeah, so that's why I got this accent, and I worked for a European multinational, and where I was heading a worldwide service organization. So I'm a graphical engineer by trade. Then I actually became an expat and I moved to the US, where I then worked for about 12 years in the United States, different positions as an executive in different companies. And one day I got introduced to the law of attraction. Yeah, you probably heard about it. You probably heard about the movie, The Secret. Like attracts like. If you put your thoughts out there, you got to feel it like you already have it, and so on, and so on, and so on. And for me, back in the days, there was like a lot of like, okay, this is just like what I do every day. I'm in sales, I'm in business development. That's how we roll. But then when I started to look deeper into it and why things did work for me, but also why things didn't work for me, I started like getting more and more curious about like, how does this really work with your putting your thoughts out there, putting your emotions out there, feeling as if you already received what you're trying to create. So it got me very interested. And then one day I was going to this holistic doctor that was recommended to me by a very good friend. And I was in his office, and there was this one chart hanging there on the wall, and it had like all the different organs of the body, and then next to it like a list of all different emotions. And I was so intrigued by it, and I kept looking at it, and was like, wow, like I wonder what it is. And then one day I'm just researching a different kind of energy modality. I think it was Psyche, and I got onto YouTube, and some lady was talking about the Psyche energy healing methods, but then she mentioned like, wow, yes, but I would also look into the emotion code. And I was like, okay, so me being curious about everything, I just like Googled the emotion code, and all of a sudden what showed up? The chart. So I was like, okay,
the chart that was in your doctor's office.
Exactly. So I was like, that is not a coincidence. So I had to look deeper into it.
Not to interrupt, but what was were you doing like some kind of like Chinese medicine? This doctor's office where you saw?
Yeah. So he was basically a chiropractor, but with a holistic approach. So where he was like, he asked me to hold my arm out. And then afterwards I found out that he was basically doing muscle testing with me. Yeah, and he was like going over the chart and then pushing my arm, but he was doing that in his head, so I had no idea what he was doing. And he said, like, oh, is it possible that you had, you were very anxious at the age of 7? I'm like, that is possible. I don't remember. That was a long time ago. Yeah. And then he was like swiping my over my head and my back. And I was like, okay. And then also he did some other testing with me. He had me hold like different vials with different like substances in there. And he had me like move forward and move backwards. And then he said, okay, I got something for you. He would go in the back of his in his office. He would give me a vial. He would say, Kristof, this is charged with a certain frequency. Don't put it next to your cell phone or a credit card, yeah, or you will deprogram what I just put in there. He said twice a day, just put it under your tongue, and you should be good in 5 days. And for me, that was all hocus pocus.
Right.
But of course, that was so many years ago, and now I 200% understand what he was doing.
I mean, you could put like a room key card for your hotel next to your phone, and then you put it in your door, and it doesn't work, right? You got to go back down to the front desk, and they're like, "Oh, did you have this next to your phone?" And you're like, "Yeah." They're like, "Don't do that."
Yeah,
some invisible frequency deprogrammed your room key card. Yeah, we accept that.
Yeah, and that we know. Yeah, we accept that from the credit card, but it's exactly the same way that it works with our body, with our energetic body. Yeah. And that's how we create a better well-being using the same methodology, the same thinking behind that we take negative emotions and negative frequencies out of our energetic body. Yeah.
I'm scared to death of these things, man. I do not like the frequency that they emit. I've had friends of mine that like stuff them, girlfriends that like stuff them in their sports bras and then they get like breast cancer. I've had friends that have been putting them in their pockets. They always have them in their pockets, and then there's like some testicular cancer that like pops up, and it's just like, I don't know. It could be, causation isn't always correlation kind of thing, but like there's definitely a frequency. I had a friend of mine, sorry to interrupt, but he doesn't trust these phones so much because of the frequencies that they're emitting, that he's not a narcissist by any means, but he has like a selfie stick, right? So like he's always got his phone. Like if he's talking to you, it's on a selfie stick. He's like, I don't want to touch this thing. I want to I'll dial the number, hit like Kristof and it'll call Kristof, but he's like, I don't like touching this thing. It's like a bad frequency all around. Yeah. But so I guess my point is that there's definitely there's definitely frequencies out there, right? I mean, we have GPS, there's all kinds of frequencies that are being emitted all over the place, and they're affecting us. Yeah. So you're talking about energy that you can tap into in order to heal yourself, right? Like that's essentially what this holistic chiropractor was doing with you, even though you didn't really know how it was working. He was teaching you something about realigning your energy or getting rid of bad energy.
Yeah. So what he was doing was basically taking out energies of low vibration out of my energetic body. Yeah. And let's first start. How do you get low vibration energy inside your energetic body? Yeah. And let's even go back another step. Like, why is it important to take low vibration energies out of your energetic body? And this for the simple reason that in today's medicine, the Western medicine world, we only treat, or for the most part, we only treat the symptoms. Yeah, and we forget about the cause. That's why when you take your pills, you get better. When you stop taking your pills, you get worse again. Or you take pills, and then afterwards you got to take stronger pills because they don't work anymore. Then you have to take more pills and different pills because they have a side effect and something else is going to get off. Yeah, which is great if you have if you're in big pharma. Yeah, you make a lot of money. But at the same time, we're not going to the root cause. Now, the root cause, most of the time, is found in the energetic body. whether you talk about physical discomfort, mental discomfort, or emotional discomfort. Yeah. Now, how does it get trapped in that and there? And this is when things happen to us during life. Yeah. For example, trauma. It could be very severe trauma, but it could be as simple as like you're 3 years old and you fall off your bike in front of your grandparents, where you wanted to just show them like, hey, I can ride without the training wheels. Yeah, which is very traumatic. Or you locked yourself up in the car. Yeah, and you were like, and you did that when you were at the age of 2, but now you're 50 and you're claustrophobic, but you don't know why it happened. Yeah, but if you would go back that far, and if you would remember what happened then, of course you don't, you're 2 years old, but with the healing modalities that are out there, with the energy healing modalities, we are able to take out those, what we call trapped emotions or blockages or low frequency energies. Yeah. So that can
do you consider this? Do you consider this a form of therapy?
Well, this therapy that you go to an LCSW, like a therapist, a psychiatrist, to do, and it works mainly on the mental level. But the thing is, when you only work on the mental level, but your energetic body is still programmed the old way, you might get better on the mental level for a little bit, but it would come back. So ideally, you combine the two. Yeah, so where you take out those vibrations that are making you afraid of being in an elevator, you take those energetic vibrations out, and at the same time you rewire your mental body. Yeah, and it's the same with the physical body. So if you have, like for example, I had somebody who had a pain in her shoulder for years, so she would go to chiropractor, massage therapist, acupuncture, and it would always get better, but then it would come back.
This is the client that you have for the energy code.
Yeah. So where I specifically was the emotion code that I was doing with her, and so she said, like, let me try that, because I said at the end of the day everything is energy. Yeah. So what we found out, like while we were clearing the emotions, so first of all, when we do that with the emotion code, we can define also the age. Yeah, we can say what are the trapped emotions, whether it's anxiety or abandonment or betrayal or crying or humiliation or jealousy, like there's 60 of those emotions. Yeah, that we can define. That's the first thing. And the second thing is we can also put an age onto it. So while we were going through the healing session, I found out also that a lot of them were shared trapped emotions. So what are shared trapped emotions? Are 2 or more people gone through the same emotional disturbance at the same time, yeah, at the same place. And then she was like, oh my God, Kristof. She said, now I know exactly when it happened and how it happened. She said, I was going to visit my mom for a week, and I stayed for 1.5 years because she was going through a bad divorce. And we went through all these emotions that you identified. We went through them together. And she said, guess what? My mom has exactly the same pain in exactly the same place.
Wow.
Yeah. So it got a lot better with her. It got a lot better with her mom. Her mom didn't even know that her daughter was doing that. But when it's about physical healing, you know, the body gets relieved and it gets better, but sometimes there's more to take care of. Yeah. And we cannot always do everything in one session, because the body needs to also adapt to what's happening underneath it on the physical level. And then after 2 sessions, pain-free. So all these years she has spent lots of money on chiropractors and massage therapists and like any healer she could find, even here in Costa Rica. Yeah. But it would come back. And now 2 sessions with the emotion code and it was gone. And that's just an example on how it works on the physical body.
Did you work with her mother as well for her shoulder?
No, because when they shared emotions and we're all connected, yeah, if I take it away with one person, it goes away with the other person. Yeah.
Wow.
And that's the beauty of this.
So what's the difference between the body code and the emotion code, or the body code and there's two different ones that are very similar, right?
Yeah. So there's the emotion code and there's the body code. So
Emotion code and body code.
so the emotion code was basically developed by Dr. Bradley Nelson, who's a chiropractor in the US, and where through prayer and through meditation, he was asking, because that's what prayer is, asking the higher power up above, like for more guidance on how can I better help my patients. And then he was basically offered the emotion code. So where he made a chart of 60 different kind of emotions, like an emotion, an example could be crying or depression. And then based on that, he would connect with the subconscious mind. And the subconscious mind is like the biggest database on this planet. It remembers everything you've ever heard, you smelled, you tasted, you've seen, and also the things that you consciously are not aware of. But it remembers everything. It's a database. The only problem is it doesn't have a logical mind. Yeah. So you when you connect with the subconscious mind of somebody, and you just do this by setting the intention, like I am connecting with the subconscious mind of that person, and it can only answer yes or no questions. And then we call applied kinesiology or muscle testing, which is the method that I use is the ring and ring method. So because we are connected with consciousness and the field, yeah, our muscles know what is right and what is not. So when I say my name is Kristof, it's going to test strong. When I say my name is Neil, it's going to test weak. Yeah. There's many different ways of muscle testing. There's a sway test where you fall forward for a yes answer, or you fall backwards for a no answer, or you do the arm testing with that. So with that kind of testing, connecting with the subconscious mind that knows everything but cannot tell you in a logical way, Bradley Nelson was able to develop a method where you would have like a trapped emotion. Say like, okay, let's say it's depression.
So let me stop you right there, because we were having a conversation before and we were talking about this, right? Because I was essentially giving you the analogy with my earbuds coming out, with the pendulum, right? I don't know how this works. I also don't know how old muscle testing is, but I know that the pendulums have been around for a while, right? And it was, I actually learned about this when I was down in Nosara. One of my friends was showing me how to work with the pendulum. And essentially she was like, I mean, you could have a pendulum that's meant for that's it. It's just, it's a pendulum. Or you can take, something that's just weighted like a necklace, and you program it, right? You say, what is my yes? It turns one way. You set an intention. You say, what is my no? And it turns the other way, right? I thought that she was actually manipulating it, like with her fingers, to have it spin. And then she's like, no, you can do it too. There's like nothing, there's no voodoo there. And then we were talking earlier about, I don't know if they're called divining rods or dowsing rods, but you were saying that, your father used them in Belgium to actually find water. They're just copper rods, like a bent hanger with handles. And, you legitimately ask, you set an intention to say, is there water over here? And then the rods will cross. It'll say no. And then you turn a different way. Is there water over here? And the rods open up, right? Like, you don't need to be some kind of spiritual master to use that or to find water. But you're like, my dad used it in Belgium. It's been around.
Yeah.
I don't know.
And he has no idea how it works and why it works. Yeah.
Right.
But at the end of the day, everything is energy. Yeah. And that's also what Nikola Tesla said. If you want to find out about the secrets of the universe, just think about frequency, vibration, and energy. Yeah. And everything is energy, including our bodies, including our thoughts, including our feelings, our emotions, our intentions. Everything is energy. Yeah. And if you start thinking in that way, there's so many things in life that become more clear to you. Yeah. And it all completely opens up your vision of life, your health, whether it's emotional or physical health, like what you can do with that.
Yeah, I mean, right in the short term, one of the things that I can honestly say, like, is, I mean, you're down in the medicine community in Costa Rica, and you have a noticeable difference in, like, if you're going into a plant medicine ceremony, for instance, right? If you do combo beforehand, right? It's another, form of medicine in which you're, like, purging all kinds of trauma and emotions. And then when you go into that ceremony, instead of dealing with it there, you've already dealt with that stuff. And when we were talking before, you were saying, yeah, you can also use, I mean, there's different, things that you can do with your diet. There's different plant medicines that you can use in preparation. Combo is not really a plant medicine, but you're also saying that, like, energy medicine, right, is something that not only is just good for you just in your life to, eliminate certain ailments or traumas, but it actually makes a noticeable difference when you're going deep, when you're taking yourself super far on a journey, right?
Yeah. No, definitely. And that's it was actually one of the indigenous healers that was here that explained it the best to me, even without him knowing that I was doing this. He said, when we are born, we're like this pure crystal. Yeah. And when we go through life, the traumas we go through, but also our education or religion or society, and that crystal becomes more and more polluted. And he said, what we are gonna do here in the ceremony is actually we're gonna clean up that crystal. Yeah, so we become a pure receiver of the light again. Yeah, and I was like, oh, so maybe that explains why, even though I went for my first ceremony, it was Yahe, which is very purging. I had an amazing time.
Now, this is just for the uninitiated here. Yahe is probably the most physical type of ayahuasca. There's all different, there's all different traditions. There's different cultures in South America, obviously, and different regions have different brews of ayahuasca. And I have done Yahe once in my life. I've gone on quite a few journeys with plant medicine, but Yahe was something that was extremely physical. I mean, for me, it was really nothing but physical. There was definitely a psychedelic component to it, but it was very subtle. But the physical purging was, I mean, it was enough to where if I never do Yahe again in my life, I'll be just fine. I'll try anything twice, but at the same time, like, if going back into Yahe, I would do a lot more preparation and energy work. It could be one of those things that I would probably find myself, just anything to alleviate what Yahe. So Yahe doesn't have to do it. I'll let you do it. I'll let Combo do it. Anything but Yahe. It's intense. Yeah.
I hear you. And for me, it was the opposite, because I had already done so much cleaning on myself, the emotional cleaning, taking out those low vibration energies out of myself. And the years before I even had my first ayahuasca experience, that for me, it was, okay, I was immediately in vision. Yeah, and they say when you envision that you already cleaned up your physical, your emotional, your energetic body a lot. So that's why I would recommend to do like some sessions, especially like a heart wall clearing is a beautiful clearing. That crystal is already as pure as it can be before you go.
What is the heart wall? The heart wall clearing?
So the heart wall is it's part of the emotion code, also discovered by Dr. Bradley Nelson, where he has found that even though he was doing releasing the trapped emotions of the people and they were getting better, but sometimes he would hit a wall, and actually what he was hitting was a heart wall. So our heart is the most important organ we have in our life. And it's not just a pump to pump the blood around in your body. Yeah, it also has brain cells. It also has emotions. Yeah. But the thing is, like with any of our organs, if we want to protect, when there's bright light that we want to protect our eyes, we close our eyes. When there's too much noise, we close our ears. Too much dust, we close our mouth. But our heart, the way our heart protects itself is by taking dense emotions from what it's going through at the moment to protect itself, and it puts it around the heart.
Does that have something to do with like a heart chakra?
Well, it's around the heart chakra, but it's not necessarily related. Where if you would have a heart wall, I can see that your heart chakra would not be as open as you would if you don't have a heart wall. But what it does, it protects you then and there when it's needed, so you don't get like a heartbreak, or you don't like you hurt your physical heart either. But it's just like a bomb. A shelter in times of war is great. You need it, yeah? But if in times of peace, if you're still looking through that slab of concrete, that's not what you want. You want to take that wall off, and you want to be open again. So open, what does that mean, open? Being able to communicate with each other. Because I'm sure you've had it when you were in a bar, or restaurant, or a place, and somebody would walk in to the room, and you was like, that guy's up to no good. Yeah, you feel it before you even saw him, or you spoke with him, or you heard about him. You already knew it. Yeah, it's because our heart communicates before our brain does. Yeah. So when you release that heart wall, you become more pure in communication. When you also, your intuition becomes more clear.
I was just going to say that. Yeah.
Yeah. So when you like, people are so looking for their purpose, but if you have like a heart wall, it will be hard to find that. Yeah. People that have extensive grieving, it is so important to take that heart wall open, so you can feel the love again of that, what the world has to offer. And
so let me ask you this: how does that differ from like your heart chakra? I'm going to give you an example, right? Like, because you're speaking directly to me. Like, right? Almost 2 years ago, I had I perceived a trauma. Right? I was in it was the end of a long relationship. Didn't see it coming. Right? And I went. That's how I got down to Costa Rica. Right? I went down to Costa Rica to sit with plant medicine, and second day that I was at this center, your group and stuff like that, we're all hanging out by the pool, and there's this guy in my group who was using a pendulum, and he was checking to see, like if you wanted to, you could lay down on a chair, on a pool chair, and he would check to see if your chakras were open. He'd go from your crown to your root. I'd never had this done before, so I lay down, and he's checking my chakras, and everything was open with the exception of my heart chakra. And he said something that kind of stuck with me. And he said, "Did you just?" He's like, "Everything's okay." He's like, "Your heart's gonna open up again. You're doing work, right? That's what you're down here for." And he said, "Did you just?" He didn't know, right? He's like, "Did you just get out of like a relationship or something like that?" And I was like, "I did." And I mean, it was as noticeable as day. I mean, like, it was just like, he's going over all the different chakras, and the pendulum is spinning, and then he goes over my heart, and it's just static, right?
Yeah.
So, like, if you're doing the heart wall on me at that point in my life, you're saying, would you say that your heart wall's closed and your heart chakra's closed? If you were to do both tests, the heart wall test and the pendulum, are they're connected somehow, or they're totally different?
Well, they're definitely going to be connected, right? Because I mean, what is a chakra? It's Sanskrit for wheel. So we have let's say the 7 different main chakras. They all work on a different frequency. So they take in the energy from the field, yeah. And what they do, they step down the energy to the frequency of your different energy bodies, yeah. Your etheric, your mental, your emotional, your astral, and so on and so on and so on, yeah. So when your heart chakra is closed, you're not feeding it anymore. So
it's protecting you, right?
well, the heart wall will protect you from that, but when your chakra is closed, and definitely like a traumatic experience when going through a bad breakup can close it. But there's many other reasons why also your heart chakra can close. Where when we talk about a heart wall, it's specifically related to emotions and feelings that it's been gone through and lock it up. I personally think, even though I also do chakra restructuring and clearing for the same reason. So I do the same thing with the pendulum, and I'm open them up again. But when it comes to that kind of healing, I would first start with the heart wall, first and foremost. Yeah. So it's related, but it's not the same.
Yeah, it was interesting because, he was saying that, I was like, well, this is good, because now my heart can't get hurt anymore, right? My heart chakra closed up. And he's like, well, it's protecting you right now so you don't fall back into, a similar situation or something like that. But he's like, what you want to do is open it as soon as you can, right? Because you're going to be able to sense more, right? You don't want all of these closures all throughout your system. And after some deep work, and chakras open and close all the time. But I guess what I'm trying to understand is are they related? In what you're saying is they're related in a way, but just if you deal with the heart wall, right? It doesn't necessarily mean that the chakra is going to open or close if you're just dealing with the heart wall. You have modalities to deal with both.
Yes, exactly.
Okay.
And the beauty of the heart wall is it will be specific just on the heart and specific on the bad breakup. Yeah, where when your heart chakra is locked up, it can be many reasons why it's locked up. So you can be working on one thing, but then you need to work on another thing, which is then still sitting in your energetic body, you have to deal with those emotions first, with those trapped emotions, which are low frequency energies that are sitting in your energetic body.
So if my heart wall was closed, if you were working with me 2 years ago, what is it that you would do to open up, to clear up, that crystal? Is what you're saying?
Yeah. So what I would do, I would use the emotion codes. Yeah. So where we would go, I would connect with your subconscious mind. I would use muscle testing to get yes or no questions. I would get an answer. I would get one of the 60 emotions that are there. Let's say, for example, it's heartache. Yeah, you've gone through a bad heartache. But then, so I will release that. We're setting the intention, and I'm releasing that from my energetic body by basically, if you're in person, I would swipe over your meridian. I set the intention. Intention is energy. I connect with the subconscious mind, and that energy will dissipate. But if I release the heartache, that doesn't mean that you will never have heartache again, or all your heartache in the past have been gone. It's like the color green, especially here in Costa Rica, when you look out, it's like millions of shades of green. And they're all at different places, and they're at different greens at different times. Yeah, so you can have the emotion of heartache at a specific frequency and a specific part of the body that happened at a specific time. Yeah?
Right.
But that's how we take it out. We say, okay, the trapped emotion of heartache, we are releasing that trapped emotion now. And it was from the age of 39. And then 39, that's when the breakup was. Yeah, I'm just giving an example. Yeah.
Right.
And we continue doing that. There's actually also ways of testing the heart wall, like how thick is the heart wall? What is it made of? Is it wood? Is it rock? Is it diamond? Is it platinum? Is just to have like an idea. And it's a gradual process. It's not something that you just do like, let's do a heart wall session. Okay, you're good to go. Like 45
because
minutes later.
somebody, like you're saying, somebody can have all kinds of things happen to them in which this heart wall is essentially protecting them, right? I mean, it's like You know, like your best friend can die, you can get into a divorce, you know, like just you lose your job, like all of these traumas, right? So the body code is dealing with each one of those traumas individually. It's more like a laser.
The
emotion code. The emotion code.
Yeah, it would do that. Now, but you mentioned pretty severe trauma, but it could also be like if you were the older of two siblings, yeah, and you're 2 years old, and your sister or your brother gets born, all of a sudden you feel neglected. Yeah, why is that? Because you don't get the only attention anymore. It is also to your sister that the attention goes. So a lot of older siblings, they have the abandonment and betrayal energies that are sitting there, and they don't even know why. But the thing is, it's sitting around the heart. Yeah, and they live through life with that wall around them without even knowing. But it's at the moment that you take it away that they feel this lightness, and they're like, wow. It's like having this backpack and you carry it along with you for 40, 50 years, and it's like 50 pounds. Yeah, but
you're used to
little grain, little rock, a little bit more over those 40, 50 years. But then when you're able to take that out, yeah, all of a sudden you take out 20 pounds. Yeah. No, you take 20 pounds off. Yeah, it's just like, oh my God, I feel so much lighter. I had no idea that happened. So it could be little things like that, like a sibling that is born, or you had to move from one state to another state, or you couldn't play soccer anymore or anything. And those are things as little as they are, but they can still add on.
And some of those things, it seems, you know, certain traumas, if you don't release them, you know, they can create legitimate physical disease in your body as well. And I think that like the easiest way to look at that is stress, right? Like stress is horrible. You know, like if you're stressed out and you can't sleep. I was reading an article the other day that said sleep is like, you know, if you're getting 8 hours of sleep in a night versus somebody who's getting like 4 hours of a night, it's almost like a PED, you know, by having proper sleep. So if you're too stressed and then you can't sleep, it's creating all kinds of physical issues. And then if you're only treating the physical issues and you're not getting to the root cause of it, and then these things keep reoccurring in your life, it's because you're not dealing with it energetically at its core. Is what I'm gathering. Yeah. Yeah,
exactly. And there's like sometimes like that we get programmed like claustrophobia. Yeah, let's say you're at the age of 2 and you locked the door of the closet and you got stuck in there. Yeah, and you didn't know what to do. You're crying, screaming, and so on. But now you're 30 and you have claustrophobia and you don't know why. But that is the reason why, because that happened to you. Yeah? And when you're able to remove that, then you're able to heal your claustrophobia, or you're able to heal your stress or depression. Yeah, because there's always an underlying reason for that, and it's in the energetic level. PTSD, for example, emotion code is a great tool to help with PTSD, because what added something happened to you, and whether you were in Iraq, yeah, as a vet, or whether you were in an abusive relationship,
a car accident.
Or a car accident, like it just triggers you. And why does it trigger you is because nothing that you don't have inside of you can be triggered. But if you have it inside of you, it will get triggered.
Right.
Yeah. And then energy healing modalities are a great tool, an easy tool to release those triggers.
You know, that's really interesting too, is because one of the things that I started learning, especially on this last excursion down to Costa Rica when I met you guys, was that, you know, plant medicine is great, and, you know, learning about different types of plant medicine and how they're symbiotic, you know, when they're working together. And then there's other different modalities that you can incorporate, like yoga and breath work and diet. And then you start talking about energy healing. People, I think, can be turned off because they're just like, you know, like, how can this work? Like how can this concept, Reiki or body code or ayahuasca, people are like, I drank ayahuasca and it didn't have the effect that people claim that it had. Well, it's like one of the things that I started realizing, and we can, get into it, later on, but it's really about how important it is to kind of like be tapped into this more holistic way of life, because I've been back in the US now for a few months, and it's insane that like, people here in the US are obsessed with drugs. Like it's not medicine, it's not healing you. These are drugs that are treating symptoms. And those people will try switching up one thing, and they're like, yeah, I cut out gluten out of my diet and it didn't get rid of this ailment, right? But I think like what's really, really important is energy medicine and plant medicine and diet and lifestyle all kind of when tied in together have these like incredible effects. And it's not a magic bullet, by just, doing body code for one session and you don't get the results that, somebody who's healed themselves, because you're talking about actually healing people, right? So it's one component of this larger picture.
Yeah, and there's different pieces to it, right? Like, first of all, you're correct. Like, they call it the triad of health, right? Where you have the emotional and the mental, the physical, and then the chemical, which is basically your diet. So where one of them is off, it will always get skewed. So ideally, you have all three of them in balance. And then when we talk about like healing modalities or energy healing modalities, or the plant medicine, there's so many different ways, and there's no one healing modality that does everything. There's no plant medicine that does everything. It is just what you think and also what you feel is the right thing for you to go through, because plant medicine is not for everybody. Yeah, you already mentioned Kambo, ayahuasca, but there's so many other ones. Marijuana, as everybody knows in the States, and it's now getting legalized. I mean, when you're here, it is used as a medicine. Yeah, and they don't call it marijuana, they call it Santa Maria. But if you set it with the right intention, the right settings, it can do a lot of healing for you. So that's why it is important to tune in with yourself, to educate yourself. And that's why we are here. That's why we're doing this podcast, so that people can get educated. Like, what is out there? Like, let me research a little bit more about this one healing modality or like this one plant medicine, and then see if it resonates with you or not. And then we're also always here to help educate you and be of guidance with that. But it all works together. And at the end of the day, whether you plant medicine or energy healing, at the end of the day, it works on the energetic level, on the level of consciousness, of your being. And that's where the true healing needs to happen. It's at the source.
Mm-hmm. Yeah. So, okay. So what are some of the similarities that we'll see? Because I think most people, for me personally, body code and the energy code are, I'd never heard of them before until I met you. I'd heard of components of it, like muscle testing, but one of the forms of energy medicine that I had received that I was somewhat familiar with was Reiki. Again, I don't really know a whole lot about it, but people who may be familiar with Reiki, what are the similarities with Reiki and these other modalities that you've been talking about?
Yeah, well, first of all, you work on the energetic body. Yeah, so you don't work on the physical body, but you work on the energetic body, so that the physical body can heal. Yeah, with both different healing modalities, and with all energy healing modalities. Yeah, so we don't. Well, we can work on something that is in the physical or in the mental or in the emotional, but at the end of the day, that would just give us a clue to where we need to go and how we can do the energy healing underneath it. Yeah, so that the physical, the emotional, and the mental can get better. Now, the difference between Reiki and an emotion code body code is that with Reiki, you basically get out of the way. Yeah, so I'm also a certified Reiki practitioner. So what you basically do is you just let the universal energies do its work, and you set the right environment. You do your cleansing. You can use crystals if you do it with people in person. We can also do it remotely, and then you just let the energy do its work, and you work on the different chakras, and then other points as well. And then depending if the person has specific pain somewhere, that's what we're gonna do. Now, what we do with the emotion code and the body code, you got to be specifically working on something. And you're going to say, okay, I'm working on the pain in my shoulder or the pain in my hip, or I'm feeling every morning I wake up very anxious. Yeah. And I'm very stressed. Like, what is it? And then we're going to work on that. And then we're going to connect with the subconscious mind and get these answers out and say, like, okay, that was at that age. That was at that age. And in a way, it also helps to mentally process the stuff. Yeah. And it's also, and that's where plant medicine is also beautiful. When you shine the light on the trauma, on the time that you've gone through, like whether it's trauma or you had to move as a little kid and you had to leave your friends behind, which is traumatic for a little kid. Yeah. So it also helps you to mentally process it.
So one of the things that I think kind of ties in here too is that I want to ask you, who is doing the healing here? Because it became instantly obvious as I started getting into plant medicine, and I mean you see people physically healing, right? I mean there's other things that are a little bit more abstract when it comes to traumas and stuff like that, but when somebody who is deaf is no longer deaf, when somebody had a terminal illness and no longer has a terminal illness after several, ceremonies, they call it in the medical world, like spontaneous remission and stuff like that. They don't know how it works, but like, it's just like, yeah, you went to Costa Rica, you sat before Sarah. It's like, how did you heal? Was it like this medicinal plant that like had some kind of effect on you and healed you? And what I keep getting from people, I was talking to Angel, one of your close friends down there in Samara, at Om Jungle, and she healed herself. She's going to tell that story on another podcast of how she healed herself from a terminal disease. And I think I kind of spoiler alert, what she said was that it wasn't the plant medicine that healed her. It was the plant medicine that showed her how to heal herself. Right. So my question to you with energy medicine is, are you healing someone, or, like or are you showing them how to heal themselves? Like, how is the healing happening? Because, again, to say that healing isn't happening when we're putting these practices into existence is just because we can't explain it from a clinical point of view. Right. But to deny that it's happening is to deny reality. So how do you see the actual healing happening? Who's doing the healing?
Yeah, like I already mentioned, like Reiki, you basically get out of the way and you become the vehicle for the healing energies to come through, which is not different than the emotion code or the body code. Yeah, the only thing is we just have more as a procedure of how to pinpoint the certain things that need to be done. But at the end of the day, we just set the intention, and
who is we, you and the client collectively?
When the client is present, but it doesn't always necessarily needs to happen that he's there physically, or that we do it online. Yeah, because those healings, whether it's Reiki or emotion code, body code, and the other healings, we can do all of them. Basically, any energy healing, you can almost all of them you can do remotely. But at the end of the day, we become the conduit for the healing. It is not like, oh, I'm so powerful, I can do this. No, I mean, you can do the emotion code. And I would invite everybody to read the book and start working on yourself, start practicing with the muscle testing, and maybe become a certified emotion code practitioner. Yeah, because it would help the world so much if there would be so many more heart walls that are cleared. Yeah, so many more people that are able to create the life they love just because they were able to heal themselves.
So that's it. It's the person, again, just like the plant medicine, is healing themselves. And the energy code, the body code, Reiki, plant medicine are the conduit that's showing them how to actually do the healing. I think that's so important. You know, like when I asked Angel, I was like, how did this particular plant medicine heal you? She's like, it just showed me how to heal myself. Right. So like it seems as though that's what this energy work is doing as well. It's showing you how to heal.
Yeah. And the medicine and the healer, they're just the conduit to show, to help you, because our bodies basically are perfectly able to heal themselves. Yeah, it is just that we put so much stuff in it, whether it's emotional or whether it's physical with food, chemical, like we put so much stuff on it that our immune system is constantly working, and it has no time to heal your body. Yeah, so that's what we're trying to do. We help and we just facilitate. Like the medicine facilitates. It takes stuff out. Trust me, when you do combo, I mean, you've done combo, it'll take stuff out.
Yeah, that's for sure. It's taken a lot of stuff out, actually.
Yeah, and it's both physically and emotionally and energetically that it's taking stuff out.
Well, that's one of the takeaways too, that I can speak to, is that it's energy work is so much more gentle than plant medicine. I mean, when you talk about something like combo, I hadn't done combo until several months ago, and there was nothing enjoyable about it at all. I mean, it was the only thing that was enjoyable was when it was done, but at the same time, it was one of these things that was like, I'd never felt so light in my life afterwards. I mean, like what was really interesting to me is that there was, my intention was to eliminate certain traumas. And I sat with Paolo, in Nosara to do my combo. And, we sat and talked for hours before we had the combo session. I mean, he figured, he was almost like a therapist working through things with me that, I wanted to just release, essentially. And when we were done, because we did several sessions throughout the course of a week, which was intense in and of itself, afterwards, when I would have these thoughts that would typically put me into this like emotional downward spiral. And, when the trauma first happened, I'd never been depressed before. It was the first time in my life I'd ever been depressed. These triggers could last for days. And then and then it subsided, but there was still these triggers that were just so painful that I was just like, it's not a depression, a debilitating depression. It's just, I just need to move past these things, right? So that was, what we were working on when we went into these sessions. And it was within 3 sessions, it was crazy that I could go back to those same memories, and the trauma had been, I remembered the memories perfectly, just as well as I did, a few weeks prior, but there was programming that had been deleted that was just no longer serving me. And my point is this, is to get to that release, combo was really, really intense. And, to your earlier point, it's not for everybody. Plant medicine is for everybody, but it's also not that combos. What would you classify combo as? It's, it's not a plant, right? It's a frog medicine.
It's basically the poison of a frog.
Yeah. But it was
very healing and very cleansing.
Yeah, and I highly recommend it. But for somebody who's not ready to go there yet, right? Like somebody who's not ready to go on, or maybe is ready to go on a journey, with ayahuasca, in which you're planning on doing several ceremonies back to back. How do I make those ceremonies less intense as far as the physical, like what you're saying, hey, that I have to go through in order, like all the horrible purging and stuff like that we hear about. You can do preparation beforehand that actually makes those journeys much, much easier. And sometimes it can just be as simple as energy work. Sometimes you might have to do some other, type of work like combo beforehand. And as intense as those things are, it's going to make that plant medicine journey, is going to make your life better by dealing with it in this it's relatively simple way. It's not that it's not work, but it's not like, purging into a bucket, over at Paolo's house for 15 minutes straight, It's a little bit more gentle. Yeah.
Yeah, it's definitely is. I call the energy healing that I practice, emotion code and body code and the Neo Shamanic work. I call it the lazy man healing. Yeah, where you basically, the person doesn't have to do anything. He doesn't even have to show up.
Take a nap.
Yeah, take a nap or just like go on with his day. Depends, of course, on what we're working on and how severe something is. And definitely I would recommend also. I mean, there was this indigenous healer that I was sitting in ceremony, and it was the yahe, the very purgative brew from Colombia that was served. And he says, like, for us Colombians, it's all about the purging. He's like, as we come here, when we come here as a soul on this planet, like we are this pure crystal. Yeah, where the light can shine through purely, but then it gets polluted by trauma, by the way we eat, by the religion that is around us, by the environment that is around us, by the world, by the news, by everything. And what we want to do is, if we want to receive that pure light again, is we got to clean up that crystal. Yeah, that's why they so believe into the purgative part of the medicine, where when you do the energy healing with the emotion code and body code, you already take away a big part of that. And that's why when I had my first ceremony with Yahe, I had an amazing experience.
That's crazy.
I thought it was the best thing ever.
Yeah. Well, I've definitely got to do some energy work, and then maybe I'll do some more Yahe. But I think one of the big takeaways here is, from my experiences down in Costa Rica and then also talking with you now, is that all of these things kind of work in it's like together, right? Mm-hmm. So it's not that like if you don't need to do energy work if you're doing plant medicine or one plant medicine. It's like there's all different types of work that we can do, and they're very complementary of each other, right? So that was my huge takeaway. I mean, just like being in ceremony, one of the big things that I found in ceremony, and I want to talk to Anne about, is that like the last time I sat in ceremony with you guys over at home when we were drinking plant medicine, is that I started learning like how the sound, right, the sound healing, right, the music that the medicine team is playing is very integral to what's actually happening within that space. The prayer and the incense and the Palo Santo and the rapé and the fire and all of these different elements combined create this environment. And if you take one out of the mix, it starts to change up, the whole recipe, right? And when I started thinking about like how important that was, and then what you're doing before you go into ceremony, right? Like what is your diet like? What types of foods are you absolutely eating? What stuff are you absolutely eliminating from your life? how important that is when you go into that ceremony. So it's not that like one thing's more important over the other as far as, rapé over ayahuasca over the fire, but they're all actually working really, really well together. And doing combo before I went into that ceremony made all the difference in the world. And what you're saying is you can even go further, right? You've got your diet in check. You're doing frog medicine before you go and do the plant medicine. Well, you can also do something as simple as energy work, which can make even the most intense forms of ayahuasca, like yahe, much, much, much easier, right?
Yeah.
So
Totally agree.
before we close out here, there's a couple other things I want to touch on. One is you're I guess what you're saying is you're a Neo Shamanic healer, right? Like we're somewhat familiar with shamanism, to some degree. What is Neo Shamanic healing?
Yeah, so I mean, it's one of the modalities that I been practicing. It's Neo Shamanic, energy healing, and it's basically that's the energy healing modality where I work with the chakras, where I open them up again, where I clear them out, where I structure them. I also work on the bioenergetic fields, the auric fields, like cleaning out clouds and mucus, which is also a beautiful preparation for going into the ceremony. Because if your chakras are closed, or sometimes they're spinning the different way where they actually take energy out, like your throat, energy. That's something that we've seen with certain medical procedures, how would I call this in a nice way, where you actually spit energy out. So when you open up the energy centers, then when you go into a ceremony, then you're also able to receive everything that the medicine has to give you. Receive all those energies, because you basically are a completely open conduit for it then. So that is part of the Neo Shamanic work. I'm also a Neo Shamanic Reiki healer. Neo Shamanic also relates back to the fact that we work with rapé, that we work with Santa Maria, that we work with Sananga to help with.
Real quick, can you tell us what Sananga is? Because this is the most intense thing I've ever done in my entire life. I mean, when you talk about the polar opposite of energy healing and taking the naps and not, what is Sananga?
Sananga is basically the juice of the root of a water plant from the Amazon.
Yeah. A what plant? A what plant?
It's a plant that grows in the water.
Okay.
Yeah. So what the indigenous people do, they take out the root, and then they kind of like scrape the root, and then they just squeeze out the juice. Yeah? And I was in the Amazon a couple of months ago with the Awanawa tribe. So we had like a fresh Sananga made, and it was very strong.
Is that more intense than regular Sananga?
Well, there's different grades, right? So, but that was, I think, the most intense one that.
Let me say this: is that like to everybody out there who doesn't know what Sananga is, Kristof can probably tell you a little bit more than I can, but I can tell you exactly how it feels. And they're drops that you put in your eye, and apparently they're extremely healing physically. So if you have physical ailments with your eyes, it can cure all different, types of, disease. It can, even just bad vision, right? But what it also works with is trauma, apparently. And essentially, I guess I'll just tell you how it feels. I've never felt so much pain in my entire life as with Sananga. If you talk about a pain scale of 1 to 10, 10 being the worst, this is like a 15. And it's unrelenting. For 3 minutes straight, you get these 3 drops put in each one of your eyes, and it feels as though somebody's like, just put like a hot coal on top of your eye. Your eyes open and these little drops go in. And just as you think you're like, okay, this is the most intense pain, it's getting worse, it's still getting worse. Now it's like at a plateau and it's just not letting up. it was one of the hardest experiences I've ever had. And I was doing at our mutual friend Paolo's house in Nosara. He was doing combo back to back with Sananga. And after those sessions, because we did, combo, and then he would do Sananga in each eye. And then as soon as it let up, 5 minutes, 6 minutes later, he'd come by again and do 3 more drops in one eye, 3 more drops in another eye. And we did that 3 times. My eyes were so swollen. They were swollen shut. But, when you talk about, what happens afterwards, I'd never felt so good in my life. There was it was just for the rest of the day, I had, once the swelling went down in my eyes, I was out at dinner later that night and I had several people. Nosara is a small place, so you're always running into people. 3 different sets of people that I ran into were like, what did you, you look different, you sound different, your whole presence is different. And I'm like, I've been doing combo and Sananga. And again, it was Sananga is so intense, but what is actually, do you know anything about actually what's actually taking place, physically, and then what that actually does to whatever traumas it is that you're trying to deal with? It just eliminates it.
Yeah. It's like with any plant medicine, right? So it works on the physical level and it works on the energetic level. Yeah, so Sananga, first of all, like you said, it helps with your eyesight. I don't know if you know that, but you can buy Sananga. I don't know if they call it Sananga, but you can buy that on Amazon.
Really? I know you can buy it on Four Visions Market,
Oh,
plug to them. Yeah. I didn't know you could buy it on Amazon. It's from the Amazon. You could buy it on Amazon. That makes sense. Yeah.
Yeah. By the way, when I said, when I talked to a shaman from the Amazon, and he's like, "Oh, we need those little bottles for the rapé." He's like, "Where do we get these?" I was like, "You can get them on Amazon." And he looked at me like,
"We're in the Amazon, man."
He's like, "We don't have them here." And I was like, "Oh, yeah."
Yeah, Jeff Bezos, Amazon.
Yeah, so it works on the physical level. So for cataract and improving your sight, but also when I do Sananga, the colors become more vibrant,
right,
to me. Yeah, so that is one thing, and then the other thing is also because the indigenous they really believe that bad thoughts is what's causing disease. So that's what it is, just releasing bad thoughts, but also decalcifying the pineal glands and becoming more open to receive your intuition.
So how often would you recommend doing Sananga for those who?
Well, they say you have to do it if you really want to improve your eyesight, you have to do it straight for 28 days. But like you said, it's not a pleasure. I mean, when I did it for the first time, it was my first combo, my first Sananga, 3 times in a row. And the second time, it was so painful. And I'm like, what am I doing? I just met this guy 3 hours ago.
Like a masochist or something like that.
Yeah.
Like vomiting and burning. Yeah.
I haven't burn holes in my skin. I actually got 11 dots the first time. So I get frog poison on my skin, and then he's putting acid in my eyes. I just met the guy. Why am I doing this?
It's a lot of trust.
Yeah, he's a beautiful person.
Mm-hmm.
And it's so healing. And you just saying, when you had 3 different groups of people coming to you.
I had no idea, what I had done that day.
Yeah,
no idea.
The thing is, physically, you might have looked a little bit different, but it's energetically that you were completely different, and they feel it too.
Yeah.
And that's because everything is energy, and that's why they felt your lightness, that you cleared it up. Yeah, and that's the beauty of energy healing, or doing the plant medicine where you release those dense energies. People just want to talk to you.
Yeah, they call it nature's vaccine, right? Combo.
Yeah,
just because
the jungle vaccine.
Yeah, it's extremely anti-inflammatory. So I mean, there's legitimate surface level, clinical, things that you can point to. that actually I had gotten this was like when the rainy season had kind of just started, and I had a cut on my arm, not from combo or anything like that. I just had a cut on my arm, and I went out surfing, and the water was somewhat compromised as it gets in Costa Rica, and I just had this bad infection on my arm. Not like I needed to go to the hospital, but it wasn't healing properly after a few days, and then one of the side effects of that combo, I mean, everything healed like instantly. If you had, a kink in your neck, if you had, this an open wound on your arm, like everything healed like ridiculously fast, on top of all of the stuff that, we're talking about with like, deep traumas that were causing me like an emotional disturbance, right? Like, and that probably absolutely transferred into, even deeper disturbances within my psyche. So yeah, it's amazing how all of these things work together. And that's kind of like the big takeaway of this conversation, and kind of like how, I guess we can get into it real quick before we close out here. But one of the concepts that we've put together here and is getting rolled out with ARRAKIS, ARRAKIS Labs, is that we're releasing an NFT, and this NFT has real world utility in which you can actually use this NFT for plant medicine ceremonies. You can use this NFT in order to have sessions with people like yourself. And it's essentially, it's all being built right now. But this NFT, by holding this token, essentially, you can go to our website, ARRAKISLabs.io, and plug this NFT in, and essentially book ceremonies for plant medicine, book sessions with yourself and other healers. And what I encourage is to use this in collectively, right? Like if you're planning on doing a plant medicine ceremony, absolutely do some work ahead of time. Figure out different ways that are going to make that ceremony more beneficial. And one of the things that we've kind of put into effect here with this whole concept is not just doing plant medicine and not just having plant medicine available, but also having other things. And as of right now, the energy work and the plant medicine component are our two, you can call it in real life events that we're doing. Even though in a way with energy work, you don't have to be in Costa Rica to get the energy work done. We can do it as remotely, like a Zoom call is what you would do if you're going to do a remote session. People aren't in Costa Rica to work with you.
Yeah, typically by Zoom call, or when people are really busy and say like, hey, can you just do the work? Like I do that, for example, with little children. I wait till they go to bed. Then I do the healing work, and then I send the email to the parents with what we found. So it's perfectly possible. And it is as good as in person. I mean, there's no difference.
Wow. Okay. All right. Well, look, we've got to circle back to some other things later on, so we'll do some more talks. But this has been, great. I've actually gotten a deeper knowledge of, who you are and kind of how you came to all this, because we've known each other for a little bit now. But it's fascinating hearing your story and your depth of knowledge. So thanks for coming on and sharing all this with everyone.
Very welcome. Pleasure.
Thank you, Kristof.
All right. Thanks, Neil. See ya.